Thank you so very much. It is an honor and a pleasure to join you and to share this information with you. Uh, I started working on Medicare since 2011, and we developed a program here in ARP, Arizona. We train some 20 volunteers on several issues, and Medicare by far is one of my favorites. A lot of times I try to prepare for these things, and it seems like the more I try to prepare, the more I confuse myself. So now these days I don't prepare anymore. I just go at it. And we developed this PowerPoint, and it's pretty self-explanatory. I do have some good information to share with you. And as we go, we are going to have an eye on the chat. So I'll pause here and there, and you can send us questions as we go. And then at the very end, we can also open up a minute or two to address any questions you have. I label this the ABCDs of Medicare. As you know, typically we use the thought of, or the concept of the ABCs of something, right? But since Medicare has another part called Part D, I label it the ABCDs of Medicare. We do have the 2020 numbers because some of these numbers that I'll be sharing with you change from year to year. So let's, this is an introduction. The objective is basic information, original Medicare and Medicare Advantage. To be frank with you, if after today's session you are clearer on the difference between original Medicare and Medicare Advantage, we've done our job. Because to me, this is the most fundamental concept in understanding Medicare, and I think your life will be easier if you can differentiate between the two of them. Discussions, who qualifies, the two options, three parts, a 7-point comparison. This 7-point comparison is going to be very, very good. So who qualifies for Medicare? Medicare is, you become eligible for Medicare at age 65, but you also have to have 40 credits. And 40 credits, it's points that the Social Security grants you as you pay the contributions to the so-called FICA tax, right? For every quarter that you earn about $1,350, $1,400, you get a quarter, a point. So then there's 4 quarters in a year, so you can accrue 4 points, 4 credits, 4 quarters paid a year. In 10 years, they don't have to be consecutive, you would become eligible for Medicare. That's very important. Then let's admit Kate. Sometimes you can get Medicare at an earlier age. If you have been declared disabled by the Social Security Administration, and that benefit is called SSDI, Social Security Disability Insurance, after you've been on that benefit for 2 years, you become eligible for Medicare as well, no matter the age. Another possibility of getting Medicare at an earlier age, anyone with end-stage renal failure at any age, they would be eligible for Medicare. Now, here's 2 options and 3 parts. Please remember, on Medicare, you will have these 2 options. And let me say this right off the bat. When somebody enrolls on Medicare with the Social Security Administration, they will give you Part A and Part B. And I usually say the enrollment with Social Security is incomplete. You must complete the enrollment by either talking to one of the area agencies on aging, an agent if you know one and you trust them, or a broker. But remember, when you get Medicare, the red, white, and blue card with Parts A and B, that's incomplete. Remember that. That's very, very important. So the first choice you're going to have to make after that is, do I want to be on original Medicare or Medicare Advantage, right? So in essence, if you have had insurance through all your life, you get hospital coverage, medical coverage, and drugs, prescription drugs. It's basically the same coverage, but in your job insurance, you don't have the sense of separation, right? You get a packet and that's it. Well, Medicare, somehow they separate the coverage. So you have Part A covers hospital, Part B covers medical, and Part D covers prescription drugs. And you notice that I skipped C. So I didn't say A, B, and D. I've always said that C should not be considered a part of Medicare because C is more like an option. In other words, if you get Part C, that refers to Medicare Advantage. You're seeing it on your screen. Medicare Advantage is Part C. When you get Part C, you have a Medicare Advantage plan, you will get all three, A, B, and D. So sometimes if you read the Medicare in You booklet that Medicare sends to people's homes, you might find the concept of A plus B plus D equals C. This is very important. So this is how Medicare separates the coverage. A, hospital, B, medical, D, drugs, prescription drugs, and then C is that option of Medicare, that second option next to original Medicare. So originally there was only Medicare, and I believe in 1997, if I'm not mistaken, that's when the Medicare Advantage plan started. So that became known as Part C. Very, very important. So let's go through this comparison because this is going to determine which way you go when you get that Social Security Medicare card and then you complete the enrollment on Medicare. That's when you're going to have to make this choice. You're going to talk to an agent, a broker, or one of the volunteer counselors for the SHIP program with the area agencies on aging. And they're going to basically explain this to you. They're going to say, all right, so we have these two options. Do you want original Medicare or do you want Medicare Advantage, which is Part C, right? So what is the difference? 7-point comparison. Fee for service. If you opt for original Medicare, when you go to the doctor, that generates a bill, and they'll be charging Medicare per visit, per service that you acquire. When you opt for Advantage, basically your Part A and B premium, Social Security will give it to the insurance company that you have selected, and now they will take care of you. If you have any issues, you don't come back to Medicare or to CMS. You go to the insurance company because you opted for Medicare Advantage. Medicare Advantage is basically the same as what you had before you reached Medicare age, is what I have right now. It's called managed care. That means they're managing your care. This insurance company is going to manage your care. And they come in the form of HMOs, PPOs, and I think special needs plans. But the most common, I would say, is HMOs. Then if you opt for original Medicare, you have a choice of providers, anyone who accepts Medicare in the whole country, right? You can go to any provider that accepts Medicare, you'll be fine. With Medicare Advantage, no, no, no. You have to stay within the network of doctors and hospital, and a specialist referral is required. See the picture? See, so this is the difference between original Medicare and Advantage. Point number 3, the no out-of-pocket limit. Having an out-of-pocket limit is very positive. I know that we don't like the word limit, but in this sense, having an out-of-pocket limit, it's like a cap. That means when you reach a certain amount, you stop paying for the remainder of the year. So that is positive. However, original Medicare does not have an out-of-pocket limit. But guess what? The Medicare Advantage does have an out-of-pocket limit. So when you buy you opt for a Medicare Advantage, that provider, that insurance company, that plan that you select will tell you, okay, so you have an out-of-pocket limit of $3,000 or $4,000 or $5,000. That means that once you reach that point, you stop paying and the insurance starts covering 100% of the bills. That is extremely positive. You want to have an out-of-pocket limit. So it's important that you know what that limit is. And number one reason for people filing bankruptcy is medical bills. So this out-of-pocket limit comes in to basically protect people from going bankrupt, okay? Now let's go to part number 4. Part B is purchase. When you opt for original Medicare, of course, you went to Social Security, you got Part A, hospital, you got Part B, you need to purchase it. where if you switch to Advantage, you do not have to pay again for Part B because you already are paying to Social Security. However, let me say this, at this point that it's important. Some Medicare Advantage plans have additional premiums. Some Medicare Advantage plans have additional premium. So Part B is included. So let's continue. Number 5, this is very important. If you offer original Medicare, guess what? Part B has a 20% co-insurance. That means that Medicare will only cover 80% of the doctor bills, and you are responsible for the other 20%. If you had an expense of $100,000, you have to pay $20,000. $10,000, you're responsible for $2,000. So that is very important to understand. On Medicare Advantage, there is no co-insurance of 20%. You don't see that. You see co-payments on Part B, which are very, very little compared to that 20%. Okay, so that's very important. Point 6, you must also purchase, if you stay in original Medicare, you must purchase a Part D plan. If you move to a Medicare Advantage, guess what? It comes with it in most cases. So here goes point number 7, right? And I'm getting stuck again here. Okay, there it is. You may combine Medigap or supplemental policy with your original Medicare. Here's where this supplemental insurance Medigap comes in, because the 20% that Medicare doesn't cover, that Medigap policy will step in and cover that. But that'll cost you. This original Medicare option, you're looking at around $300 a month. Whereas if you move to the Advantage side, you cannot combine Medigap with Advantage because in some sense you don't need it because you don't have that 20% co-insurance. So this is basically what you're going to face coming to complete your enrollment on Medicare. And some people, it's a little difficult for them to understand this. I would venture to say that some people feel comfortable. I believe there's like a 40%, 45% of the country is on Medicare Advantage. I think Arizona is a little higher than that, some 47%. So people, the Advantage plans are working hard because they want, obviously, the business, right? They want people to move from original to Advantage. And keep in mind that if you travel, you have 2 homes in different parts of the country, people tend to go for original Medicare, so they don't have to, they don't have an issue. They can go to providers of choice. People who stay put in one particular area, they tend to go with Medicare Advantage. So let me, I have a note that some plans have additional premium. I'm talking about the Medicare Advantage. So when you see in the news or when the commercials say that, oh, no premiums or 0 premium, that means additional premiums because you're still paying the premium forever and ever and ever to Social Security for your Part B. Right now it's at about 148 in 2021. So let's go now to explain original Medicare, okay? There it is. So let me go into detail a little bit more. So I explained the 7-point comparison. I consider this very, very important. In original Medicare, we're going to talk about hospitalizations, which is Part A. Part B is medical care. Part D is prescription drugs. And we're going to talk about what is not covered, and then the other insurance that you can combine with Medicare. Obviously, Medigap is one of them. So keep in mind that when we are talking about Part A, you have to be admitted to the hospital. Sometimes you go to the hospital, you're in observation. You are not, in other words, you're still under Part B. Part A kicks in when you are admitted to the hospital. It will also cover skilled nursing facility care, which is rehabilitation when you have maybe had a surgery at the hospital. But there's also some requirements there. You must be 3 days in the hospital, hospitalized, admitted before you are eligible for skilled nursing facility care. And you will also have hospice. Hospice is end of life care, and then you have home health care. So that's what Part A covers. Here you don't have a premium. The premium, if you had to pay one, runs about $400+ a month just for Part A. But because we pay the FICA tax for all of our working lives, we don't get charged a premium for Part A. So that's basically what I'm saying there. The deductible. Yes, there is a deductible. And in Part A, under original Medicare, you will face, if you ever, or you know someone who has been hospitalized, or you have, you will face something called the benefit period. The benefit period. So they'll charge you an annual deductible, not an annual deductible. Typically deductibles are annually, but in Part A, original Medicare, you go through an annual, not an annual deductible, but a benefit period. So basically what it says is, I want you to spend 60 days without having to be readmitted. That's the benefit period. So in other words, if you go to the hospital and use 10 days, you are discharged, and then before you spend 60 days without having to be readmitted, you come back, you're still in the benefit period. But the moment you spend consecutive 60 days out of the hospital without the need of being readmitted, you have ended your benefit period. Then the next time you are readmitted, you have to pay the deductible again. That's all I want to say now because of time. Now, co-payments, day at the hospitals, you will have no payments in the hospital for days 1 through 60. Then you, after you pay the deductible, of course, and then those numbers, you can pause the video if you want to see the actual numbers, but there will be co-payments per day in the hospital, days 1 through 60, no days, I think that should have been, 60 through 90. There's a typo there. It's days, sorry, my microphone is hiding the 6. 61 to 90 is 352 a day, and so on. And then you have a reserve day of 6, a lifetime reserve days of 60. So you can tap into that if you run out in any given benefit period of the 90 days. And then the skilled nursing facility care, no payments from days up to 20, and then 20 to 100. You pay 161 days. So those are kind of like the figures. You will get this PowerPoint so you can kind of do it in a more, in a slow way. You can pay attention to those numbers. But in hospital, this is what you will face if you have original Medicare. Keep in mind, original Medicare in hospital Part A. Now let's go to Part B in original Medicare. You will find medical care, doctor, specialist, outpatient care. In other words, you go to have surgery, you're out the same day pretty much. Durable medical equipment and preventive care, preventive services. This is your Part B and under original Medicare. There is a premium. This is the one that is deducted from Social Security. And if you sign up for Medicare before you start receiving your Social Security benefits, they will bill you for the 3 months at a time. But there is. And learn this concept. There is something called means tested. People who make, I believe it's $85,000 as an individual or more, or 170 as a couple, they will pay a higher premium for Part B. There is a deductible of $198 a year. And there's no co-payments for Part B in terms of medical care, okay? Then yes, there is co-insurance. So every time you have medical care, you're under original Medicare, you have Part B care, you will be responsible for 20% of the bill unless you have some other policy, Medigap, to cover for that. Part D, prescription drugs, obviously through private insurance companies, you have that. The premium, it varies from plan to plan, and it is means tested as well. If you are a higher earner, you pay higher premiums for Part B. Deductible, typically yes, but there's a lot of variation here. That's why it's important to talk to somebody who has knowledge of all the plans, because some plans might not have a deductible for Part D. And remember, this is original Medicare. You will learn a little, you will see differences when you go to Medicare Advantage. Co-payments, yes, it varies. Remember, prescription drugs, they put the drugs in tiers, right? So if one plan puts it in this tier, it'll have this price. Then another plan may put the same drug on a different tier. That same drug will cost you less on another plan. So this is where, again, depending on what drugs you take, prescription drugs, you will do good if you review plans and find out which plan works best for you. Coinsurance, yes, there is coinsurance. I know many of you might have heard about the donut hole, which I said was a gap in coverage. There used to be a point where the plan pays up to this amount. I'll pay 75%, you pay 25%. That's what I have here. And then from this amount to this amount, there is a gap. And they used to call that gap the donut hole. There was no coverage. The plan would pay zero. You would have to pay 100% of the cost. And then if you reach a catastrophic stage from this point to that point, then you only pay 5. Well, for a few years since the Obamacare or the Affordable Care Act came along, it started negotiating discounts. So while people were in that gap, donut hole, they were giving them discounts to help folks because the plan covered nothing. Well, up to, I believe, this year, the discount has reached 75%, meaning that people will pay basically the 25% during the gap that they pay during the first stage of coverage. So 25% all through the catastrophic stage. So this is something the Affordable Care Act did, which was very, very positive. And again, I just explained that this is the discounts that that are given during that donut hole. So pretty much we can say that the donut hole has been closed. Remember, original Medicare, Part D. What is not covered? Long-term care is not covered. Most dental care, dentures, eye examinations related to prescription drugs not covered. Cosmetic surgery, acupuncture, believe it or not, is going to be covered in 2021. Good news for many. Hearing aids and exams for fitting them is not covered. Routine food care is not covered. So let's go now. Those that are on original Medicare, they can combine insurance with their coverage. And typically it is Medigap, right? So Medigap, and I'll get into the plans in just a bit, but this is an insurance plan that you buy to cover the gaps that Medicare doesn't cover, okay? So this is called supplemental insurance. It pays for deductible co-payments and co-insurance for parts A and B, has a 6-month pre-existing condition sign-up protection. I want to just say a little something here because I think it's important. The Affordable Care Act brought in the concept of pre-existing protection against pre-existing conditions. You have 6 months since you turned 65 and have Part B, 6-month protection against pre-existing conditions, no questions asked. The Medigap, I'm talking about Medigap, will have to sell you a policy. After the 6 months, you are not protected. They will be underwriting, so it's gonna depend on the company. They can charge you more or they can deny you coverage. But during that 6 months, you are protected. May include foreign travel and emergency coverage. This is something you need to find out. Now, Medicare coordinates with other insurance coverages or coverage. It could be from employer, union, VA, TRICARE, federal, long-term care insurance. There is a way if you have another kind of insurance that will coordinate coverage with Medicare, and that you need to basically find out from both, primarily from the source of insurance that you have, say from work, see how it's going to work with Medicare. Medicare functions as primary insurance in some cases and secondary in others. So now here's what I was talking about on original Medicare when people buy Medigap. If you like original Medicare, if you like to go to any doctors of your choice, hospitals, any state of the country, you said, no, I am going to stick with original Medicare and I'm going to buy a Medigap, a supplemental insurance, you're going to come and face this kind of chart. And this is also on Medicare, on the Medicare and You booklet. You're going to select from plans A, B, D, G, K, L, M, or N. And basically what you're going to compare is basically how much coverage do I want, right? There's a plan that is going to cover you all the services. You can tell that plan G, if you look at plan G, that seems to be the one that covers the most, but I can guarantee you they'll charge you the most. And then some other plans will cover you the sections on the left, the benefits, and then the percentages. You'll see this kind of chart. So if you want to buy supplemental insurance, you're going to need to select one of these plans. And so they will not be able to discriminate you for pre-existing conditions during the first 6 months that I mentioned earlier. Very, very important. So let's go review Medicare Advantage. Medicare Advantage, you know, is very interesting because Medicare Advantage is pretty much the same as what you have now in your employer coverage. So that's why I keep saying these two choices, original versus Advantage. Original versus Advantage will be I guess the most important decision that you will face when you come into Medicare. And just keep in mind that there are there are times when you can change back and forth from original to Advantage, from Advantage to original. But keep in mind that if you're going to change from original to Advantage, easy. But if you're going to move from Advantage to original, remember the pre-existing conditions protection. Remember that this is going to be very, very important. That's why the knowledge will give you a good foundation to make the right choices. So again, we're going to cover the coverage. Remember, so now we have moved to Advantage. What are they going to cover? The same thing. Inpatient care, you have to be admitted, in network with HMO, nursing facility care. Let me just mention that hospice is not covered by Advantage plans, but original Medicare will step in and cover that service because the insurance companies on their Advantage do not cover it, but you will be fine because original will step in and cover hospice. And then home health care. You will not have a premium for hospitalizations. This is what is the equivalent of Part A under original, no deductible. And you see the difference here when you are hospitalized under the Advantage option, they basically charge you an amount for a number of days and then they cover the rest. This is how they handle the payment for hospitalizations. A little different than original Medicare. Remember the benefit period concept under original? This is where this is different. Here they'll charge you, they may say, under the plan that you purchase, we're going to charge you $250 a day for the first 4 days, and then we'll take care of the rest, basically. And this is per episode. This is not per benefit period, per episode. Once you're out of the hospital, the whole thing starts again. So that's basically a difference you'll see on the two options. No coinsurance. Okay, so medical care, you will get the same care. Medical care, doctor, specialist, you have to stay in network with the HMOs, inpatient care, durable medical equipment, and preventive services. Something that is important to note here is that you must be referred to a specialist if you get an Advantage plan. That's very important. And original, you do not. The premium. So I put 145, which now is 148 in 2021. So remember, once you start paying the Social Security, that premium for Part B, it doesn't matter whether you stay in original or you move to Advantage, you will keep paying that for the rest of your life. The only difference that people on Advantage might see is if that plan you purchase has an additional premium. Then you'll see an extra charge there. But some of the plans offer additional services. So if you're paying an additional premium, find out what additional services they are providing. Medicare Advantage plans cannot offer you less than original Medicare, but they can offer you more than original Medicare. So you do have an original a premium under Medical Care for Advantage. And the means tested is also applies here. It is means tested. Those that make more money pay higher premiums. No deductible on medical care. Remember that the co-payment, yes, but it's considerably less than the 20%. Remember, under original, you had a 20% co-insurance, actually. It's supposed to be in co-insurance, not a co-payment, where here you do not have the 20%. You do, but you do have co-pays, which are less. And then, obviously, no co-insurance. Prescription drugs, again, under original Medicare, sorry, under Medicare Advantage, pretty straightforward. You do have the coverage. It comes with the plan, unless you buy a plan that does not include the Part D plan. But if I was you, I would buy one that includes Part D, right? The Advantage plan I'm talking about. So pretty much some do have a deductible, some don't. The premium is means tested again. And then yes, there are co-payments depending on the where the drugs are placed on the tiers. And then co-insurance in general, it will be 25%. So you will basically pay about the same 25% for drugs, and the plan will cover 75%. And then if you reach the catastrophic, you'll pay only 5%. So let's talk about, we only have about 20 more minutes. So here's something very interesting. We're going to talk about 3 more points, and then we'll finish. The first one is Medicare Savings Programs and extra help, enrollment periods, and resources. Here's something very important for people who have lower incomes, and I mean lower incomes. There are something called, the programs called Medicare Savings Programs and extra help. So the Medicare Savings Programs, we have 3 of them. Let me show all 3 of them. We call them in terminology that we use is the Quimby, the Slimbys, and the QI1s. Quimby, Slimby, and QI1. These last 2, they pay only for your Part B premium. So people who qualify for these programs are not going to have to pay that $148 a month that is deducted from Social Security. So they'll be able to keep $148 every month because they are of low income, and the Medicare Savings Programs is helping them. Now, the Quimby is the best program. So if you are really, really low income and you qualify for Quimby, you're pretty much getting healthcare for free. So these programs are paid for by, in Arizona, Access. So Access, the Access program comes in to pay for basically whatever Medicare doesn't cover, including the premium, especially on the Quimby one. And on the Quimby one, it gives you the option of getting the benefits that the Access Health Plan has. So if you have a Quimby program, if you qualify for Quimby, you're going to be getting more benefits than what Medicare covers. And those benefits are basically what the Access Health Plans contain. So you'll add them to your benefits. So qualifying for Quimby is like the best. And then the other 2 will pay you for your Part B premium. And then there's also Medicare Extra Help. This is a low-income subsidy. This relates to Part D. So if you qualify for any of the previous programs, you automatically qualify for this one too. So be mindful that there are these two programs that are very helpful, especially when income is very low. It helps with Part D costs. So let me just go back to that. This slide really, especially if you know people who are of low income, or you yourself may be of low income, really understand these 2 programs because they can help you a lot. Now let's go to re-enrollment programs. We have the initial enrollment period, right? When folks are eligible for Medicare originally, they will have 7 months, 3 months before, the month of, and 3 months after the month of their 65th birthday. If you miss that, you will need to wait for the general enrollment period. That means you're going to have to wait until January, from January to March 31st, and then the coverage that you select during that general enrollment period, because you missed the initial, is going to start in July. So you will miss a few months with no coverage if you miss the initial enrollment period. And then penalties for late enrollment may apply. 10% for every year that you delay Part B, and 1% per month that you delay on Part D. So there are penalties involved, and then the fact that you have to start coverage way a few months down the road. So let me just say make another comment here. Some people reach 65 and they're going to continue to work and have health insurance through their work. That is called creditable coverage. You do not have to sign up for Part B if you will continue to work and have coverage. Both have to apply. Work after 65 and have coverage from your job. That's called creditable coverage. You do not have to. Then after you lose either the employment or the insurance coverage, one or the two, because they have to apply that, having employment and insurance through employment, creditable coverage, you will have 8 months to enroll on Medicare Part B. But we don't recommend you to wait that long. We honestly recommend that you do it the week after, if possible, because there are other deadlines related to Part D, which gives you 2 months to enroll, and then the 6-month pre-existing condition protection. You don't want to wait 8 months because that only gives you 6. So what am I saying? Do it ASAP. So the general enrollment period, January 1 to March 31st, if that is missed, right? That will apply if you miss the initial enrollment. This is just what I explained. There could be penalties if you wait too long, and then the penalties are for life. So if somebody is penalized 20% because they spend 2 years without enrolling on Part B, so that's 20% is going to be added to the premium of that year. And to every year new premium, you add 20% to that, 20% to that for the rest of your life. If somebody has the Medicare Savings Programs, those programs pay for those penalties if they apply. Then the special enrollment period is when life events happen, changes in other coverage, you move to another state, to another county, then you can make changes during special enrollment periods, right? So that's basically pretty straightforward. And let me just mention that COBRA is not considered creditable coverage. So if you have COBRA after 65, that's not going to cut it. You have to enroll on Medicare. Always be in close touch with the HR department to ask these kinds of questions. I'm talking about those that are going to continue to work after 65. That's very, very important. And you know, frankly, I see this often in calls that I get. I think I got like 50 calls in the last month, about 50 calls personally. And many people, tend to work past 65. So all this information is very, very relevant. And then the open enrollment, we are currently on open enrollment. It'll go from October 15 to December 7. Do review your coverage. You can make several changes. Like I said, you can move from original to Advantage, from Advantage to original. You can change your Part D plan. You can change from one Advantage to another, etc. So this is the time to do it. And then there is a Medicare Advantage open enrollment period. This is very, very new. And this only applies to those who are on Advantage. They can basically move back to original or move to another Advantage plan. This is fairly new, and it's from January 1 to March 31st. This only applies to those on Advantage. And remember, pre-existing conditions could become an issue. If you're moving from Advantage to original, keep in mind pre-existing conditions. Be proactive if you receive Social Security. Okay, so when people are on Social Security, they automatically are sent at 65 the Medicare card. If you're not ready to enroll, you can return it, and you should. So remember that. Those that are already on Social Security, when they reach 65, they are automatically enrolled. You're not ready to enroll, send it back. If not, they'll start either deducting from your Social Security check the Part B premium or billing you for 3 months, like I mentioned earlier. Uh, the websites on government websites are improving a lot. I am very, very pleasantly surprised. You can go to Social Security, ssa.gov benefits/Medicare, and you can enroll on Medicare. You're going to need to create an account, which is very important, but you can use those pages. Do not procrastinate, avoid decisions. So here's the last point, and I think I'm going to have at least 10 minutes to entertain some comments or questions. Here's some resources. The SHIP program. The SHIP program is called State Health Insurance Assistance Program. That is a very important tool or resource to have. You have a website there on the screen, and then you can reach the number. The area agencies on aging, in reality, the 800 number is the SHIP program. So no matter where you are in the state, you can call the area agencies on aging, the number there. I did include Region 1 because of the PowerPoint. I didn't, I should have double checked it, but it doesn't hurt. I have this Region 1 information, but you will reach your region, wherever you are in the state, by dialing the 800 number. And then you can always go to medicare.gov and you can find information there. And then, of course, ARP, we always keep good information on our website. Guess what? I'm going to stop here and I'm going to entertain some questions.